Welcome back. Continuing the news. We begin this segment with a primetime news follow-up. Administrators at the Spanish Town Hospital continue to lament the bed shortage at the facility due to the rise in COVID hospitalizations. Krista Campbell visited the hospital where it was revealed that many of the critically ill patients are young people with no pre-existing conditions who waited too long to seek medical attention.
Patients are coming in faster than they are leaving.
When you see the numbers climbing and all your COVID designated areas are full and you're just wondering what next.
Administrators at the Spanish Town Hospital in St. Catherine say they're running out of space to put COVID patients. The hospital has 277 bed spaces, but over 400 patients, including those with the coronavirus.
And if we use 100% as capacity, we're at 100 and almost 70% capacity.
In terms of COVID-19, initially our capacity for that was 80, but now we are more than 100, close to 200.
We're admitting probably, I would say, 20 suspect cases per day, and I would say that well over 50% of those will eventually turn out to be COVID positive.
A field hospital transferred from the National Chest Hospital in St. Andrew to Spanish Town Hospital in St. Catherine provides an additional 40 bed spaces for COVID patients. Now we're unable to go inside because the area is highly sterile, but inside we're told there are many more patients than medical staff, and like their colleagues at other health facilities, they are overwhelmed.
Every day you go out, you see the elderly sitting in a chair, and it really breaks your heart. And it seems inhumane, but there's nothing you can do physically. So what we do is to ensure that we have stringent bed management. Once a patient goes, we identify quickly who is next to go on a bed.
You may have one doctor seeing 50 patients, and 50 patients in isolation are in different areas because we don't have one space to hold 50.
But before moving into any other isolation area, the medical staff must first doff, remove their personal protective equipment, and put on an entirely new set of PPEs.
The gown, the gloves, the face shield, the mask, the different types of masks, the cap, the shoes. So it takes time to don.
10 to 15 minutes on average, and removing the PPEs has to be done very carefully to protect the medical staff from contracting the virus. Ambulance workers say it's especially difficult wearing the PPEs for a 16-hour shift, which is what they now work on average every day.
It's very uncomfortable. It brings a lot of heat in your body. It's very, so when you finish and take off our COVID suit, the sweat.
And that adds to workers' fatigue.
I have a mark on my hand. It's from a girl that was dying and she held my hand like this. And while trying to get her hand off of me, she cried me here. That's about a couple months ago, or years ago.
The medical staff say they get psychological support, spa days, and shorter than usual leave from work to help them cope. But with reduced numbers and increasing COVID patients to treat, the work continues. But increasingly, medical staff are themselves contracting the virus.
We have over 400 nursing personnel, which includes all category of nursing, the staff that we supervise, and about 3% of that number, they are out on quarantine, isolation.
And that leaves fewer hands to care for moderately and critically ill COVID patients. The senior medical officer is concerned that many of them are young people without any pre-existing conditions who are waiting up to 10 days after worsening symptoms before going to the hospital.
It's a difficult task when they come in so ill, and that is one of the problems with COVID on that spectrum of critical ill and almost at the end point of all organs failing. I think so far we have had 2 patients who are partially vaccinated. But for all the other admitted ones, they're unvaccinated.
Meanwhile, as the demand for oxygen increases, administrators say they keep constant watch to ensure they have enough supplies on hand. Krista Campbell, TVJ News.